Hi, I'm Dr. Divya Sehra, consultant gynecology and gynae-oncology at Manipal Hospital, Dwarka. Today we will be talking about a very interesting and a common topic called as PCOS. You may have heard the name somewhere and you might have a relative or daughter or sister affected by it. What exactly is PCOS and how common is it? How can you prevent it and can it lead to any long-term effects? So PCOS is nothing but hormonal imbalance and it increasingly becoming commoner because of our westernization of the diet and lifestyle. What happens usually is that the ovary releases one egg per menstrual cycle. But in PCOS, what happens is that the ovaries are not able to select the egg which will be ruptured during that menstrual cycle and it leads to anovulation, meaning no ovulation. Because of that, patients tend to have periods very less frequently, sometimes once in 2 months, 3 months, 4 months, or even some women only bleed when they take medications. Apart from infrequent menses, another problem is when they have menses, they have very heavy flow. Also, there is an increase in weight gain which is unexplained and unrelated to the diet that they are following. Some people also have a lot of hair in the unwanted areas and need to go waxing and threading at more frequent intervals. Some people have acne and it is resistant to any kind of medication which is given by the dermatologist. So, how can we prevent PCOS? PCOS can be prevented by a combination of factors. Like one, most important and most efficacious is the modernization of the diet, a modification of what we eat and how frequently we exercise. So we are exercising about 30 minutes a day, at least for 3 times in a week. That is sufficient. We should record our BMI or body mass index, which is our weight to height ratio. If it is more than 25, we need to be aware. Secondly, a diet rich in fruits, vegetables, colored items has shown to be very efficacious. Cutting down on alcohol, smoking, sugar and salt really helps. So if you are maintaining a regular diet, the eggs start to become in place. The axis, our mind to ovarian axis tends to become better and the periods also come more frequently. Apart from that, if you have diabetes, if you have high blood pressure, if you have thyroid disorders, that also need to be under check. So take your medication regularly, record your blood pressure and the blood sugar testing at recommended intervals and you will see a change. Thirdly, there are drugs that can be used to regularize your periods, usually called as oral contraceptive pills. They are not contraceptive only. They have non-contraceptive benefits because it's a combination of 2 hormones. So these days, a lot of good medication which do not have those kind of side effects are being increasingly popular. So if you take those medications at regular intervals, like about every month, you will have a regular cycle and you will not be tensed or dismayed about your menstrual cycle. Another thing is that we can offer drugs to decrease the hormone which is testosterone, which leads to acne and unwanted hair, that is finasteride or spironolactone depending on your condition. There are some people who do not want to take oral tablets and for them we have an excellent measure called intrauterine systems which are implanted in the uterine cavity and these small copper T-like devices are hormone filled and release a certain amount of hormone each day which tends to cause less effects on the body as overall. So the treatment of PCOS is actually a combination of these agents and not any one drug in particular. And you have to be patient while you are on the treatment because sometimes it takes months and even years to be corrected. Sometimes MDT or a multi-joint clinic with an endocrinologist, a psychologist is also known to be beneficial. In long term, PCOS can lead to your health bad health effects like worsening of diabetes, worsening of high blood pressure, and if you are bleeding less frequently, it can also lead to uterine or endometrial cancer. So be aware and prevent yourselves from PCOS. Thank you.